Good morning, good afternoon, good evening, and good night, ladies and gentlemen. It's indeed a privilege to have a conversation with Dr. R.S. Sharma, a former secretary to the Government of India, a former chairman of the Telecom Regulatory Authority of India, and the primary architect who helped develop the National Health Authority of India with the objective, a fantastic objective to eventually, in my lifetime, I'm sure is going to happen, a universal health coverage for 1/6 of the entire population on this planet. Just to give you a background, I'm a neurosurgeon turned tech enthusiast. About 22 years ago, when telemedicine was a dirty word, I ventured into telemedicine, and today we run one of the largest telehealth units in this part of the world. I have divided this entire program, which is called Challenges in Digital Transformation of Healthcare in the most populated country in the world, India, into 5 or 6 subdivisions. I intend to show a couple of slides, show you real life examples, and then pick the brains of Dr. Sharma. I don't know how many of you understand that about 1.4 million Indians still depend on the private sector for healthcare. 2/3 of the hospital bed capacity is opened by private sector. You take it any way you want, doctors, super specialists, specialists, etc. This slide is self-explanatory. I'm just going to give you 2 illustrations of public-private partnership projects. I think it's amazing that the Government of India has recognized, and instead of making problems for the private sector, they have made it so conducive. We run the world's largest teleophthalmology project. We have been doing this for almost 5.5 years. Yes, that's not a mistake. What you see on the slide is 2.7 million patients multiplied by 2. 5.4 million eyes have been examined, evaluated in great detail by 35 ophthalmologists who physically are 100 to 200 kilometers away. As you can see, I'm a little bit lazy. Otherwise, I'd have updated this dashboard even 5 minutes ago. This is a real-time dashboard with the government of Jharkhand, one of the relatively not too advanced states in the country. And as you can see here, we have set up digital dispensaries for the last couple of years. Everything is transparent, updated in real time. Just look at the numbers. They're almost the population of many countries in the world, whether it be laboratory investigations, whether it be just checking your vitals, teleconsultations, and so on and so forth. CSR, corporate social responsibility, is something which has taken off in a big way in the last couple of years. And again, Apollo Telemedicine Networking Foundation, which I head, plays a very active role. The World Economic Forum, the Bill Gates Foundation, and several other global organizations, we are working with them with the primary aim and objective of providing equitable healthcare to anyone, anytime, anywhere. I strongly believe that a solution is not a solution unless it is available to everyone. And this is the entire idea of digital health. Dr. Sharma, the previous slides were just to make this global audience understand PPP. As one who was actually called back from their formal retirement to take responsibility of developing CoVIN, the COVID-19 Vaccine Intelligence Network, and your team did a fantastic job of ensuring 2,000 million, 2 billion COVID vaccines were given in the most populated country within 2 years. As CEO of the former CEO of the National Health Authority of India, you have implemented a major public health insurance scheme, and till very recently, you are heading the Digital Health Mission of India. Sir, over to you. Please let us know, as a bureaucrat, as someone who has been primarily in charge of developing policies for the entire country. I am only an end user. I am a beneficiary. I am a clinician, maybe a pathway between the patient and between you, but you are the people who ultimately hold the fate of 1.4 million people in your hands. Your comments, sir, on public-private partnership.
Well, thank you, Dr. Ganapathy, for these initial slides, and I think they do indicate the scale of the problem and the scale at which we all deal with. As you yourself, indicated, I am basically an administrator, and I have also, like you, deep interest in technology for governance. And essentially, before, during 2015 to 2020, I was the chairman of the Telecom Regulatory Authority of India. And basically, my concern was always the citizen centricity of the telecom sector. So basically, the data prices came down from 275 rupees per gigabyte to 7 rupees, which is about 10 cents per gigabytes. And now every Indian is having video calls and in a very free manner, because he doesn't have to pay so much. So what happened was that during COVID, while we were working on COVID, and as you said, I was brought back after the retirement. And then, I realized that we were using digital communication means to communicate with our doctors, with our service providers, with our pharmacists, and with our laboratories. So we thought that why should we not create a framework so that the entire interaction and entire use of digital technologies in health service delivery becomes a formal system. And because of the fact that health is such an important issue and sensitive issue, how do you protect the patient's data? How do you make him in charge of his or her data? How do you create an scalable framework? How do you create longitudinal health records of a patient so that he or she is able to see the records as also share with his or her doctor? How do you create a framework which actually can ensure that the services are able to be available? How can we create an interoperable framework so that a video consultation application A can communicate with the video consultation application B? You have been in the area of telemedicine for a long time, and we all have eSanjeevani, and we have a number of telemedicine applications. How can
Could you give me your, sorry to interrupt, we'll be coming to this later. Could you give me your specific views on public-private partnership?
No, I think basically I'm telling you the background which started this digital mission or Ayushman Bharat digital mission, as it is called.
Okay.
So that I think is relevant in the context of the COVID pandemic which happened. So essentially, this application or the solutions which have been developed, or the architecture which has been developed, actually inherently is public-private partnership. It does not distinguish between the private service provider and public provider, because everybody creates and generates data, and that data to become interoperable and becoming available to the patient, it is important that we create a framework which is interoperable and which is scalable. And scalability obviously is absolutely required in Indian context, because India is 1.4 billion, and as you yourself said, it is 1/6 of the world population. So therefore, I think what you have said, that 60% of India's healthcare is in the private hands, and therefore any program or any proposal of the government which does not take into account the private sector's participation is not really worth the proposal. And therefore, what we have done, or what we are implementing now in the name of the Ayushman Bharat Digital Mission or National Digital Health Mission, is essentially a program of public-private partnership. Thank you.
Thank you. Thank you so much. I'm just going a little into the details, just to show you the evolution and very rapid progress which has been made in the last 5 to 6 years. It all started with the National Health Policy in 2017, National Health Stack in 2018, the Digital Health Blueprint, and so on. On Independence Day in 2020, hardly 3 years before, the National Digital Health Mission became operational. And what were the directives of NDHM? They brought into, for the first time in the country, they brought transparency, accountability, and democratization in healthcare. Patient, providers, payers, all members of the ecosystem were taken into account. Traditionally, it is only the patient and the doctor who used to constitute a major role in the healthcare system. But today, modern medicine, we only play a relatively smaller part. India is a paradox. We have centers better than the best, centers of excellence. It is no exaggeration to say that we are the Mecca of healthcare, attracting 150,000 patients every year from Western countries, from developed countries, and most of this are for doing procedures where there were problems in other countries. Major urban-rural health divide, the present term used, people seem to like this word, phygital, a combination of physical and digital. Now, citizens don't have access to all medical records. Citizens do not have information about all doctors, hospitals, laboratories, and until recently, it was impossible for somebody to know where a neurosurgeon is available, where a pediatric cardiologist is available, where an oncologist is available, and so on and so forth, whether it be the private sector or the government sector. Similarly, doctors do not have access, did not have access to patients' medical history. Most all over the world, in fact, patients do what is called doctor shopping. They go from one hospital to another, from the private to the government, from the government to the private, etc. And unfortunately, most of the records, investigations have to be repeated. So the most fantastic thing which I think Ayushman Bharat is doing is, as Dr. Sharma just now pointed out, the distinction between private and public is slowly blurring. Originally, they were divergent, then they became parallel. Now I think they're actually converging. So policy makers like Dr. Sharma, they are ensuring that we have facilities to ensure complete monitoring and control in a unified manner. What today is called ODE, or Open Digital Health Ecosystem. We say it is open because it is open to everybody, a secure digital health platform. It is patient-centric. Everything evolves around the patient. It incorporates healthcare access, affordability to all. In fact, the entire health system is being reimagined, so it were. And what is very, very important, I, as a former practicing clinician, there are hundreds of instances where I did not have a continuity in care. A patient who was operated in Delhi would come to me for post-radiotherapy treatment. I had no idea what was the procedure he had undergone there. And today, to use an Indian Sanskrit word, Atma Nirbhar Bharat is making India self-reliant. Gone are the days when India used to be talking of achieving world class. In my lifetime, we are going to see the world wanting to achieve India class. And this is because our whole attitude has changed from importing. Today, we are becoming a digital nation, digital India made for the world. This is, of course, slides borrowed from NDHM, which, as I mentioned, Dr. Sharma was running for a long time. And you can see here, personalized health, federated health records, coverage and claims platform, health data analytics. In fact, the entire spectrum of healthcare. Healthcare in India is no longer referred to diagnosis and treatment, but incorporates every one of these. Sir, I would like to have your thoughts on this, elaborate a little on what I mentioned, and other organizations, particularly what I was not able to find in the literature review, specific referral to short-term and long-term plans, which would be of interest to all of us. Please let us know what we can expect from Ayushman Bharat in 2025, maybe 2030, and who knows, even in 2035. Over to you.
So I think it will be of interest to the audience if I explained the basic architectural overarching principles of Ayushman Bharat Digital Mission. So the first is that when you basically want to create a longitudinal health records of a person, then what you need to do is you need to have some kind of health account of that person. So health account is what we call ABHA, Ayushman Bharat Health Account. So that basically what you have described in your slide as personal health ID is essentially Ayushman Bharat Health Account. In a bank account, you keep the money. In the health account, you keep your basically the records. Now, second thing which is very important is that federated architecture, which means that if you go to a hospital X and that hospital creates your record, whether it is prescription or whether it is other record, that record is kept there in the hospital itself. However, because that record is linked to your identifier, which is the Ayushman Bharat Health account, then that link of that record is kept at a central place called Health Information Exchange. So that is the second step. Third is essentially, India has developed a number of digital public infrastructures, digital identity, digital payment system, all these infrastructures which are horizontal in nature and which can be plugged into any domain. Those infrastructures come into play. And basically we have a centralized kind of just links, not really any record, so that once a person gives his consent to share the record, that consent token is sent to the concerned hospital whose record is there and in the link. And then that hospital basically releases, after verifying that the consent is from the concerned person, to the doctor or to the device of the doctor or for the patient. So this is the architecture in which a person is able to make his or her longitudinal health record share with his or her service provider, health service provider. Now, secondly, there are all the pieces of puzzle of the telemedicine in place. For example, the interoperable telemedicine systems I spoke about. Second is, when you do a telemedicine consultation, you need to know that the doctor with whom you are consulting is a genuine doctor. So basically, we have the concept of health providers registry, and that registry enables you to verify whether the doctor is a genuine one or not. And secondly, once the doctor writes a prescription, he can digitally sign that prescription with a device with something called e-sign, which is digital signature on demand, and can send it back to the patient. Now it is a digitally signed document, and therefore it can be presented to any pharmacy for any prescription. Similarly, the person can pay using the UPI, the Unified Payment Interface. So therefore, the entire transaction of telemedicine is starting with the consultation, search, booking, etc. gets completed. So I think that's the architecture which is privacy preserving, which actually ensures that data is federated in the sense that data is not accumulated at a single place, which ensures scalability and which ensure that the patient is in control of his or her data. So that's very, very important. And almost, today we have 400 million health accounts have been created, 400 million. Similarly, about that much number, 400 million health records have been linked with these health accounts. And the Honorable Prime Minister launched this program in September of 2021, which is just about less than 2 years back. And in 2 years, we have made so much of progress. And I think the way things are going, people are realizing the value of this kind of digital systems. And you can store your digital health record in digital locker also. There is a digital locker which has got 6 billion documents stored in that digital locker. So every citizen has a private space on a public cloud. So that's the architecture. And these are the infrastructures which have been created, which ensure that the patient is in command.
Thank you, Dr. Sharma. As you can see in this slide, from era of computerization, automation, we are now entering into the open digital system. Now, as I mentioned earlier, as a clinician, we now are changing our emphasis from diagnosis and treatment. We want to keep people healthy. In fact, Dr. Pratap Reddy, the architect of modern hospital care, who founded the Apollo hospital system, one of the largest in the world, he says he wants to reduce the number of footfalls into a hospital. We want to take the hospital to where the patient is. A doctor in your pocket, a laboratory in your pocket, even a hospital in your pocket. And today we are talking of home sensors, ingestibles, wearables. Fitbit has already launched a major project with Apollo Hospitals and Google, where we are trying to prove scientifically whether all this additional data is really going to make a difference in the healthcare outcome of the patient. Precision medicine, personalized medicine, these are no longer buzzwords, but what is going to happen very soon. Bedside artificial intelligence, 3D printing, biofabrication, and so on. You're all familiar with IoT, but how many of you, a global inter-American audience, know that IOMT, Internet of Medical Things, is today being practiced in at least 20 to 30 of the leading hospitals in the big metros of the country. Today, we talk not just of remote health monitoring, we talk about tracking medication intake, we talk of smart hospitals, we talk of smart wheelchairs, everything is smart. We no longer work hard, we work smart. And these slides are self-explanatory. RFID tracking is done everywhere, and this is what is going to happen. Simulation, this is the simulation center in Madras. We run the largest simulation center in this part of the world, set up at a cost of $2 million. And today, the National Medical Commission of India has made it mandatory for many postgraduates to spend 3 to 4 weeks every year in a simulation laboratory. The metaverse is something which is really happening. We are talking not of AI and robotics. We are talking of virtual reality, augmented virtual reality, extended virtual reality, and so on and so forth. I'm mentioning all this just to give you an idea. The topic is digital transformation of healthcare. So when we talk of transformation of healthcare, we're talking of producing the next generation of doctors. We need to train them. We need to make them future ready. And there are going to be more and more problems of getting cadavers for dissection. And though I belong to the BC era, trained in the 20th century, before computers ever came to the hospital care system, I had to concede that today a virtual dissection is probably as good or better than the conventional dissection we had. We always believe in being future ready. Sometimes I think Indians suffer from a disease called pilotitis. Every time we talk about pilot, proof of concept validation and so on. For the last 2 years, we have been using drones in healthcare. And today I'm very happy that the World Economic Forum has formally recognized and have stated that the POC stage is over. We are now using drones in one of the remotest states in the country, in the hilly mountainous areas in Meghalaya. We are also using it in Arunachal Pradesh and several other countries in northeastern India where conventional roads are extremely difficult to get. Though a technology enthusiast, I strongly believe that technology has also a limitation. However, from a public health perspective, I would like Dr. Sharma to comment at a macro level, at a 40,000 feet level. Do you think that all this, are all these just good for making presentations, for giving lectures, writing papers? Or do you, sir, see the use of all this technology in the real world, in rural India, suburban India? And do you think that this will eventually reduce the urban-rural health divide? Or is it going to be the other way about? The rich get richer, the poor get poorer, and the difference between the haves and the have-nots are going to become even more. I would value your opinion.
No, thank you, Dr. Ganapathy. I think what is happening is that the entire slew of technologies which you just presented, each of these technologies has to be leveraged in a way that it is inclusive, number one. It basically should not leave out those who do not have the means to access this technology. And therefore, what is important is that all these digital technologies require connectivity as a utility. So that is something which India has very, very beautifully solved. Today, Indians are using about 20 gigabytes of data per capita per month, 20 gigabytes. It is the highest in the world. Today, India's mobile networks transport more data than the mobile networks of US and China put together. These are facts, they are not fictions. So essentially what is happening is that because the connectivity is available throughout the country and we have a 4G connectivity throughout the country, data is being consumed at a very major speed because of the cost is more or less very, very less. And then what is also happening now, 5G is coming. And once you talk of 5G, then all these technologies, 5G has got a beautiful, USPs. One, it has a high throughput. So therefore, you can have multiple sensor. It has machine-to-machine communication. It has very small latency, which basically make it very, very useful for health-related applications like remote surgeries or other kinds of applications. So I think all these technologies, AI, for example, is now being used in many decision support systems. And what we have done in the National Health Authority is that we have hosted a number of applications which actually are now being used as software as service. So suppose there is an application which actually, analyzes your X-ray, and then you can, just plug in or just input the X-ray image in the digital format, and it can give you a second opinion. It can give you an opinion as to what issues you have. So therefore, rather than, owning a system, you can use it as a service. And this is something which is going to become very, very dominant, way of using software in near future. And that will basically make the availability of the software easily within the reach of the common persons. So therefore, I think all these technologies are not something which are for the exclusive elites or something like that. They are basically also now available and accessible to the common people. And I think the more available they become, the more, fine-tuned they become. For example, AI engines, the more, and who can, after all the AI engines work on the data. And who can provide data than India? India is 1/6 of the population of the world. So therefore, we are a very, very data rich, yet poor country. And I'm sure this data richness is going to contribute tremendously to the growth of our country in terms of, using all these digital tools to improve diagnostic, to improve service provision, to make this service provision more affordable and also more ubiquitous. Because after all, the telemedicine and other kinds of tools basically ensure that you can be in a very, very remote rural area and still you can consult the best institution of the country. So therefore, I think technology, I agree with you that technology is merely an enabler. It's not really something, we need doctors, we need professionals. We certainly need the service providers. But what is required is technology makes the provisioning of service more affordable, more ubiquitous, more accessible, and certainly more accurate as these digital systems improve and keep on working.
Thank you, Sharma ji. You are absolutely right. Now, this slide just shows, I just picked up a few at random. The Niti Aayog, which for people outside India, is a planning commission of India, the think tank of India, which plans for the next 5, 10, 20 years. And I was delighted a couple of years ago when healthcare was identified as one of the 5 sectors where AI could be used in a big way. And this is just an example of 6 specific clinical conditions where AI is now being used on a day-to-day basis in some of the leading hospitals in the country. It is slowly permeating down. It is going to take some time, but whether it be COVID, whether it be analyzing a CT scan of the chest, whether it be chronic obstructive pulmonary disease, I'm not going into the technical reasons, but just to tell you that what AI products developed in India, I think as an Indian, I'm justifiably proud that today we are having ongoing discussions with the NHS UK. We have already tied up with the Vancouver Hospital, Canada, with Alexandra Hospitals in Singapore, Dubai, in the Netherlands, etc. Totally made in India product, conceptualized, designed, validated, everything done in India. And these AI products are being used in other countries of the world. Dr. Sharma has already spoken about 5G, and I was actually shocked when in a meeting, which I was a panel discussion a couple of months ago, I found no less a person than the principal scientific advisor to the government of India, mentioning that the government has already formed committees to start work on 6G. And I think this shows the tremendous how people are becoming future ready. There are at least 30 to 40 5G enabled ambulances being deployed in the country as a pilot project. And I think this is going to happen. We have all heard of ChatGPT. Of course, we know that some people belonging to the older generation feel that all these architectures and things like this will eventually dehumanize medicine. Medicine will become impersonal. I don't think so. It depends entirely on the individual. And some hospitals in India have already started using ChatGPT. To me, what is absolutely fascinating is that government hospitals, traditionally, there was a belief that the private hospitals are far more advanced than the government hospitals, but this is not necessarily true. And here is a new media report of a government hospital in the capital of India, Safdarjung Hospital, performing the 200 international life surgery using robotics. 200 robotic surgery is no big deal, but promoting this 200 as an educational procedure for making hundreds of surgeons from all over the world listen in, peep in, watch every step of the surgical procedure 200 times, I think is absolutely a great event. I would like Dr. Sharma to give his concluding remarks, of course, for lack of time. But before he takes over and has the last word, I cannot help but mention that I think there should be a difference at the end of the day between my cousins on the right-hand side. These are all my cousins who are at home with a mobile phone, with a touch screen, and perhaps they even will one day intelligently operate it. But will all the technology in the world enable you to empathize, to sympathize with the patient? At the end of the day, digital health transformation, ladies and gentlemen, is all about the beneficiary. The one who is the beneficiary. It is not the government. It is not the doctor like me. It is the individual patient whose headache, whose neck pain, whose diabetes, whose hypertension, etc., must be treated better. Ultimately, the healthcare outcome using AI, using all this technology is important. And therefore, I think it's most appropriate that we have a word called website. We were all half a century ago, I was taught bedside manners. Today, I would like to teach website manners, and I think this is very, very important. If Moses were to come down to the earth again, I'm sure that every one of his 10 commandments would be prefaced with the word, thou shalt digitally transform. It depends entirely on how you see yourself. A kitten looking at a mirror could very well think that the kitten is actually a lion. One can ignore reality, but one cannot ignore the consequences of ignoring reality. I think we need to be future ready. Again, 4 decades ago, public health and people, my classmates, so got admission into public health because if they could not become a cardiologist, a neurosurgeon, and things like that. The world has changed completely today. And today, I think that policy decision makers like Dr. Sharma, the health economists of the country, and people who are actually involved in public health, digitally transforming public health, they do much more than a neurosurgeon who has spent 5 decades of his life operating on brain tumors. I think policy makers today probably play a much bigger role than individual cardiac surgeons or nephrologists or whatever you call it. You can have the last word, sir. Please give us your comments before we close down.
Well, thank you very much, Dr. Ganpati. I think you have laid out all dimensions of the digital health area, and also what are the new technologies which are being used. I would like to point out a couple of additional things. One is that there is a huge amount of innovation ecosystem which is developing around health devices. And basically these devices are the digital devices, whether it is mechanical heart valve or other kinds of devices which measure the diabetes and other things. And what is happening is that these devices are actually bringing down the cost of diagnostics. Now that's a great development, and I am at the Indian Institute of Technology, and there is a huge incubation system which is working here, and there are a number of boys and girls who are working on these digital health devices. So that's one development which has taken place. Secondly, what I also feel is that we are, for example, let me just give you some statistics relating to the insurance coverage of people of India. Ayushman Bharat Pradhan Mantri Jan Arogya Yojana, ABPMJY, basically has insured about 50 crore individuals, which is about 40% of India's population, the lower population, the basically poorer part of the population. And we provide insurance cover of 500,000 rupees per month, per person per year, per family per year, not per person. And believe me, we receive 1.2 million health claims, 1.2 million hospitalizations every month for this population. And the entire thing is basically digitally processed. Not even a single piece of paper is used. So the hospitals upload these, bills, and then of course they go to the state government or the insurance company, whichever is the mode of implementation of ABPMJY. And that basically you can imagine about 1.2 million per month, works to about 15 million per annum. That's the number of bills which get processed. And what we have developed now is health claims exchange which basically will ensure that the processing of bills of even private sector, insurance companies and hospitals will become much easier and much more transparent. This will actually ensure that the insurance cover of the private sector companies also is increased and people are able to do OPD insurance also. Currently, that is not being done, and a very insurance coverage of healthcare in India is pretty dismal at this point in time. But I think technology will make it more, because the cost of transactions will reduce. In India, the game is basically large volumes and low value transactions. And if you can reduce the cost of transactions, then everything starts playing. Today we are doing 9 billion UPI transactions per month of very, very small value. Today we are doing 91 billion Aadhaar authentication for all kinds of service deliveries. And these are being this is sort of spread to the entire country. So I think what is important for us to realize that if we continue to play a game which is anti-monopoly, we are not into the monopolistic kind of situation. Like in America, you have two companies, Cerner and Epic, which control about 70% of the health data, and that's not interoperable. So what we have actually started is essentially a democratic, as you rightly said, democratic movement, which actually ensures a very low entry barriers for any player. And there are large number of technology players now happening in the digital health space, whether it is personal health record applications, whether it is search applications for ambulances, for pharmacies, for other kinds of things. And you can now search, book, avail, and pay with all digitally. So that's the revolution which we are having. And I'm very sure, and I'm very hopeful that, like many other digital public infrastructures which our country has created, we will also ensure that this happens. Lastly, I would also say the biggest challenge of digital health is its adoption. And that adoption actually includes everybody, the hospitals and the doctors. And initially we found that the doctors were the most hesitant to actually adopt digital. And I think that probably will have to change. And how will it change? It will not change by forcing the doctors. It will change to make the whole digital process easier for the doctors than what they currently do. And that is the trick, and that is the key. And I'm sure more and more AI led applications which will make it easy for the doctors to write prescriptions digitally and to write sort of speech recognition systems. All kinds of systems are developing. Similarly, we have developed based ChatGPT and other AI engines. We are developing a project called Bhashini, which ensures that there are multiple languages and translation of these languages and communication in these languages will become possible. So that's another very, very important development which is taking place, which will make the digital healthcare systems much more inclusive. So these are very, very positive signals, and I'm very sure that the health is going to be the next sort of revolution or next digital stuff which is going to happen in India. Thank you very much, friends, for being with us. And good night, good morning, good evening, good noon, whichever part of the world you are in. Thank you.
Thank you, Dr. Sharma. The last 3 minutes overview which he gave very clearly shows that you cannot learn swimming by a postal course. Obviously, Dr. Sharma has dirtied his hands, has gone into it, and that is why he is able to give us such a amazing overview of it, as it were. And as you can see, both of us are passionate about digital health. We could go on and on. 2,500 seconds is certainly not enough to talk about digital transformation of healthcare, less alone India. But all good things must come to an end. Thank you, Tori. Thank the organizers once again of Converge and Accelerate. I'm sure both of us wish we could have been physically present there, but where the mind and the heart is, there is your true existence. And we are teleported to your audience, and we do hope someday we will meet. Thank you once again. I'm signing off now.